Hi, I'm Dr. Eric Wimmers. I'm a plastic and reconstructive surgeon. I work in Princeton, New Jersey, and I do the full gamut of reconstruction, which entails limb salvage, abdominal wall reconstruction, breast reconstruction, perineal procedures, scalp reconstruction. I do specialize in a couple of things. I have a couple peripheral nerve procedures that I specialize in, as well as microsurgery. I do a lot of breast reconstruction, which utilizes microsurgery in the form of a DIEP flap, which is a transfer of tissue from the lower abdomen to the breast. All right, so let's talk about breast reconstruction with fat grafting only. This is not a typical type of breast reconstruction, but it's an interesting type of breast reconstruction for someone who doesn't want implants and also doesn't want to go through a major reconstructive surgery such as a DIEP flap. This is one other option that I perform. What it entails is multiple surgeries where I inject the patient's fat into the breast. What it involves is, step one is liposuction. So using a small cannula, a metal cannula, I suck fat out from somewhere else in the body, such as the abdomen or the flanks or the inner thighs. That fat is then washed and processed and then injected into the breast. This is an outpatient procedure. In terms of discomfort and the post-operative experience, it's a pretty quick recovery. Usually patients have discomfort for about 1 week after the procedure, and that's not at the breast site, but actually at the donor site where we take the fat from. Using fat grafting as the sole method for breast reconstruction. It's a little bit of a difficult way to reconstruct the breast, and not my preferred way to reconstruct the breast, but for the right patient whose goal is a small breast, such as a B-cup size breast, this can be performed. The usual type of breast reconstruction I perform is either in the form of an implant-based reconstruction, or more commonly I perform an autologous reconstruction with a free tissue transfer or DIEP flap. That's a longer procedure, usually about 7 hours with a 3-day hospital stay. A major undertaking, but with excellent results. For those patients who are not interested in either of those first two options, sometimes fat grafting can be a good alternative to those procedures. One of the downsides to fat grafting for the sole reconstruction of a breast is that it requires multiple surgeries, usually on the order of at least 3 surgeries, maybe as many as 5 surgeries, to inject all the fat that's necessary to build a breast. It generally can't be done in one setting only. In terms of who is a good candidate for this type of reconstruction where fat grafting is the sole reconstruction, like I said, it's limited to those patients who do not want to undergo a flap procedure and do not want an implant, or maybe they've had some problems in the past. This is a procedure that can be done, and I can get great results in terms of fat grafting only, but it should be limited, in my experience, to someone who is petite, who has a goal breast size of perhaps a B cup in terms of their breast volume. The outcome in my hands has been great. I can achieve a natural appearing breast, and also the palpability, or how the breast feels like a normal breast. Depending on if the patient needs a nipple or not, I can do a nipple reconstruction as well to create symmetry. But the breast, in terms of the size and the appearance of it, looks like a normal breast, feels like a normal breast, and can match the opposite breast.